And welcome to Abington News and Views. Let's go right to Tom Kirk for this special report.
Thanks, Dan. Another demonstration in Abington Township as a group supporting President Obama's healthcare program held a candlelight vigil on Keswick Avenue in Glenside.
What do you want to have that?
I currently don't have insurance myself. I'm a part of the figure that you mentioned. My coverage actually happens via the fact that I'm married to someone who has a good credit. Okay, it's covered under the family option. People like me are included in those numbers. Those numbers are highly inflated. The real number of people that are, if somebody gets injured in an accident, where do they take them? They take them to the hospital. And people who go to the hospital get refused care.
No, they get paid for that. Excuse me. And is that
what do you think's going to happen? What do you think's going to happen when we look at this?
Excuse me. I was a financial social worker in a hospital. Okay. I'll tell you what happens to people who come in that don't have insurance when they have an accident. If they break their bone, no, they do not. They get stabilized, and there's no doctor for plastic surgery. I worked in a hospital as a social worker. I know what I'm talking about. You get stabilized, you do not get sick.
Senator Kennedy's speech to the Democratic National Convention, in which he declared that health care is a right. Not a privilege, but a right.
Your sign says healthcare can't wait. Why can't it wait?
Because when somebody is sick, they need the health care right then. Sometimes people have waited so long that they've died waiting for insurance companies to pay their benefits, etc.
Now, the opposition says, that you can go to the emergency room. Your thoughts?
Well, I'm a nurse, and emergency room care is extremely expensive, and we are paying for it now. Also, it's a poor way to manage a condition. For instance, asthma. You can keep asthma controlled if you have good medical care and somebody can live a healthy life, whereas if you're not going for your regular visits and your regular medicine, you'll end up in the emergency room very sick. Both, your health will be gone and it will be extremely expensive. So the emergency room is very overburdened and overused for routine care by people who don't have insurance.
Abington police looked on as another group gathered nearby, protesting against what they call Obamacare. Your sign says Obamacare equals no choice.
I mean by that with Obamacare, he's trying to get in the public option or universal health care. Once the government gets involved, eventually, if not right away, there will be no competition. Because if you're competing with the government, who do you think is going to win? The government is. So eventually, there will be no choice. You will have no choice of which insurer to go to. It'll just be, decided for you by the government. That's what I mean. Even eventually, if there's too many doctors in one city, Obamacare will probably say, if you have too many doctors here, some of you have to move to a different area so you can, cover some more people. Because again, if they're going to add 50 million people, but they're not going to add any doctors, you're going to have shortage of care. So they're going to have to ration. And that's what I mean. They're going to have to ration, and your choices are going to, go down.
Are you equating this Obamacare, so-called, as socialized medicine like they have in Europe?
Yes, I am, absolutely. That's his ultimate goal, is socialized medicine as they have in Europe. That's his goal.
Down to Florida. While watching a virtual town hall with President Obama from
there are 3 or 4 people who have those kinds of stuff. I'm glad that there are many people who are very concerned about health care and want to see honesty and true information given out to people. I know there are people who don't think it's a good idea, but much of the information they have is erroneous, and it makes me very sad that they're not willing to listen and read the bill and find out what's actually going on.
Now, did you read the 1,000-page bill?
I didn't read the whole 1,000.
Well, how do you know what's in the bill then?
I guess because I've seen many summaries, and I have actually skimmed the whole bill. I can't say I sat carefully and read it carefully word by word, but I have actually skimmed the bill.
The situation got a little testy as both groups merged and ideas clashed about the pros and cons of this hot-button issue. Let's listen in.
Medicare has worked wonderfully for a long time.
What planet are you on? Medicare.
I think I'm on Earth, same as you.
Medicare's almost out of money. And it's almost out of money. It's almost bankrupt.
So I guess your point is that change, is it just that you're afraid of change?
No, not at all. We're not afraid of change. We're afraid of the government bankrupting another program.
We have a new one now. We have Barack Obama and a new Congress.
Medicaid doesn't work. Nothing the government runs. Tell me one thing that the government runs profitably.
It's not there to make a profit, it's there to give health care. The government is there to make health care, not a profit.
Exactly.
Insurance companies are spending like 35%.
It's running out of money. There's not enough money to cover. I love this country. I love this country, but I don't want to bankrupt it.
Battling. I'm sorry. I'm not fighting them. I'm asking his opinion. I'm sorry.
Now, you think the press is instigating something here?
No, I don't think the press is instigating anything, but I think when you give the opposition all the attention and the noise increases because you got the light on, it's the wrong message. This is where 95% of the people are, and that's what you ought to be showing.
Now, I actually interviewed two people here. One was pro and one was against. So, what's your message here? I should be interviewing both sides?
Of course you can interview both sides, but the problem was that the noise that was coming from over here was interfering with people paying attention to what was going on in the focus of the vigil.
Well, actually, the reason I came over was people were talking. They were making noise before I came over.
Fine. Fine. Go right ahead.
No one on either side changed their mind over this healthcare issue, and the debate goes on. This is Tom Kirk reporting from Glenside for Abington News and Views.
Hi, I'm Glenn Beck.